You've heard of performing under pressure, but what about performing during brain surgery? Welcome to the Goodish News channel. I'm Ashley, and around here, we skip the doom and gloom and focus on the tiny shreds of good news, keeping that last spark of hope alive. A 65-year-old woman named Denise Bacon recently did something pretty incredible. She played the clarinet while surgeons operated on her brain. Denise was undergoing a procedure called deep brain stimulation, or DBS. Her surgeon performed the 4-hour operation while she was fully awake, under local anesthesia. And I get woozy over a blood draw, so good job, Denise. Before the surgery, Parkinson's disease had gradually taken over Denise's life. She struggled even to walk, but playing music was nearly impossible. Denise was a talented musician and played clarinet in the East Grinstead concert band, but 5 years ago, her tremors got so bad she had to stop. During the operation though, once doctors stimulated her brain, she could suddenly move her hands smoothly again. She even gave the medical staff a private concert and played her clarinet during the surgery. If they didn't give her a standing ovation, I'm going to be really upset. After the procedure, Denise said she could walk better immediately. She's also hopeful she'll soon be able to swim and dance again too. Deep brain stimulation involves placing tiny electrodes into a very specific area of the brain that controls movement. The electrodes are connected to a small device, kind of like a pacemaker for the brain, that's implanted under the skin in the chest. The device sends steady electrical pulses to the brain. Those signals help reset the irregular communication between brain cells that cause Parkinson's symptoms like tremors, stiffness, and slow movement. To make sure the electrodes are placed in exactly the right spot, the surgical team uses an imaging frame on the patient's head. Think of it like a GPS for the brain. Surgeons make tiny openings about the size of a dime to reach the targeted brain area. Patients are awake during the procedure because surgeons need real-time feedback. They can test the stimulation immediately and see whether it improves movement. Denise's ability to play the clarinet mid-surgery wasn't just for show. It let the team know that the electrodes were perfectly placed. But you have to admit, playing the clarinet mid-surgery was a pretty big flex. To understand why DBS works, it helps to know what's going wrong in the first place. Parkinson's disease develops when nerve cells in the part of the brain called the substantia nigra start to die off. These cells produce dopamine, which is a chemical messenger that helps coordinate smooth, controlled movements. As the nerve cells die, dopamine levels drop, and the brain signals get scrambled, leading to things like tremors, stiffness, and balance problems, among other things. Researchers still don't know exactly why those brain cells die, but it's likely a mix of genetics and environmental factors. Exposure to pesticides, pollution, or industrial chemicals may play a role. There's also evidence that a protein called alpha-synuclein builds up in clumps known as Lewy bodies and interfere with how cells function. It makes things pretty messy in there. Age is the biggest risk factor. Most people are diagnosed around age 60 or older, though some do develop it earlier. Men are slightly more likely to get Parkinson's than women, and while having a close relative with a disease raises your risk, most cases aren't directly inherited. Along with those physical symptoms I covered, Parkinson's also causes a lot of problems that we can't see, like fatigue, depression, sleep problems, and memory changes. There's still no cure for Parkinson's disease, but treatments can make a big difference. Medications that replace or mimic dopamine help many patients, though their effectiveness can fade over time or cause side effects. That's where DBS comes in, especially for people whose symptoms aren't well controlled by medications anymore. Not everyone with Parkinson's is a candidate for the surgery. Doctors typically recommend it for people who've had the disease for several years, still respond to medication, but have severe movement symptoms or side effects from their meds. It's not a cure. DBS doesn't stop Parkinson's from progressing, but it can dramatically improve quality of life and reduce the need for some medications. DBS is also used for other movement disorders like essential tremor or dystonia, and even in some severe cases of epilepsy or even obsessive compulsive disorder. Like any brain surgery, there are risks, which include infection, bleeding, or stroke, but doctors say these problems are rare, and for the most part, the benefits outweigh the risks. Just like most surgeries, recovery takes time. The brain stimulator needs fine-tuning over several weeks to find the right settings. But when it works, the results can be life-changing. For Denise, Parkinson's had taken away many things, but thanks to DBS, she's getting those things back, including her ability to play music.
And gradually getting more and more stimulation, and that I can see that when I try to play the clarinet, it's gradually getting better.
And while DBS isn't a cure, for people like Denise, it's restoring her independence and giving her a second chance to do the things she loves. My favorite part about this story is it proves music really can move you, especially when it's powered by a few well-placed electrodes. If you're looking for more good news in your life, be sure to check out this video right here. And if you enjoyed this video, please give it a like and consider subscribing so we can ignore all the bad news together.